Throughout the series, we will feature diverse child and adolescent psychiatry researchers who will share their wide array of research topics and career wisdom, and also introduce foundational research concepts such as how to get started in research, how to find a mentor, developing a research idea, finding funding support, presenting and publishing your work, and much more. Please note that this session will be recorded. And today we're going to be hearing from 3 prior ACAP research awardees about their research experiences and any tips or pearls that they've picked up on how to complete successful award applications. Today we are honored to hear from Dr. Joseph Aloi, Dr. Tashalee Borwn, and Dr. Herman Velez. And after they've introduced themselves and their work, please feel free to ask them questions using the chat box, which I will go ahead and moderate. If anyone wants to submit anything anonymously, please feel free to message me in the chat. Otherwise, we can go ahead and get started. And then Dr. Aloi, if you could start us off, and then we'll hear from Dr. Borwn and Dr. Velez.
Sure. Yeah. Thank y'all for being here tonight. My name is Joey Aloi. I am a 4th-year psychiatry resident at Indiana University School of Medicine. My area of research is neuroimaging of adolescent substance use disorders and disruptive behavior disorders. And I think that that this area of work is really a combination of of a lot of things that I like doing, from working with, it allows me an opportunity to work with patients in a way that I might not otherwise get a chance to work with them in a research setting. It allows me to it allows me to explore a lot of different skill sets that I enjoy, but maybe not necessarily enough to do like 100% of my time. And I mean, as a researcher, I've been able to meet and interact with a lot of really, really cool people too. So, those are some, so when I was a medical student, I was fortunate to get the NIDA ACAP Gene Spurlock Award for substance use research. And I currently have an ACAP General Resident Award to support some of the research I'm doing here at Indiana University.
Hi, I'm Tashalee Borwn, and I'm a 2nd-year child and adolescent psychiatry fellow at UCLA currently, but I also trained at WashU in St. Louis. And I'm the current recipient of the, well, actually in the last cycle, I got the ACAP Pilot Research Award for learning deficits and psychiatric disorders. And that was for a project that I actually came up with through my own clinical experiences. And that's sort of like how I usually come up with sort of like project ideas. I'm really interested in sort of, social determinants of health, racial and ethnic disparities in mental health care, community partnered mental health interventions. So I had an experience in a clinic where I noticed that there were disparities in access to genetic testing in populations from diverse backgrounds. And I wanted to understand sort of like on a broader level, like, how this was happening, and why this was happening. What were some of the barriers to care? What are some of the access issues? And so I developed this project to use electronic health records to investigate how Black children with autism and intellectual disability, whether they were getting access to the same sort of cutting edge services like genetic testing that their white peers were. And so this project developed out of that. And I'm also interested in anti-racism training. So I have a project in which I'm using different cognitive behavioral approaches to teach anti-racism to mental health care professionals. And that's a year project that involves things like surveys and focus groups, trying to collect data and develop an intervention that's targeted. And the ultimate goal is for it to be web-based and sustainable. So, and that's some of the work I've been focusing on.
This is my turn. I'm Herman Velez. I'm a first-year child psychiatry fellow at New York Presbyterian, Columbia, and Cornell. I did my residency at Boston Medical Center. I'm also a pilot research awardee, and I think from my experience and what's so beautiful about psychiatry is that our own lives inform what we do and the research we do and how we interact with our patients. And I'm originally from Colombia. I'm an international medical graduate. I moved 2020 for residency in Boston. And I moved in the middle of the pandemic, emergency flight, embassy was closed, Social Security was horrible. And I draw from my cultural elements a lot of resilience and things that help me keep going. So my project was about cultural factors that promote resilience. And one of the things about research is that you don't have a fully developed idea. It could be like that. That's kind of like what started brewing in my mind. And then I started meeting with different people at BMC. And then they were like, oh, it would be interesting to see how that works with undocumented kids. I was like, oh, that's so interesting, because also there isn't a lot of research with undocumented kids. And then with a different supervisor, yeah, you should do qualitative research. You should do some interviews to get some themes and see how you can kind of start approaching the topic. And then the idea started developing, and then that I finished the project and was presented the poster and had a couple of presentations about the project during AACAP. I also got a research grant through the APA Foundation on structural racism. I did implicit bias testing on race and skin tone on mental health providers, and then triangulated that with their own outcomes. So we're still working on those results. And I think where my interests are taking me, because how much I just love being in the community-based research. We can talk more about it, but there's like a whole new spectrum of like things to do, how to do research, co-create research with the communities that we work with. And that's kind of the general kind of my passions in research and my experience.
Thank you so much. That was so interesting. It's really cool to hear about the different ways that people get involved and the different projects you're all working on. So right now we can open the floor up to questions. So again, any participants are free to just type your question into the chat, or you can direct message me if you would prefer to be anonymous. And we did get one question. The first one was, how did you all hear about the ACAP and other awards that you received? And we can keep it alphabetical as well, just for simplification. So Dr. Aloi.
Yeah, I think for the first one, I had a mentor who was involved in ACAP, just emailed me and said, hey, there's this thing, application deadline is in a couple of weeks. Do you want to apply? I should, I guess I should say too, because this is going to affect kind of how I answer questions and kind of how I've gotten into things, that I did an MD PhD program. So this was like at the beginning of my PhD program. And I applied and I got the award, and then ever since then, I actually kind of look at the ACAP website every couple of months and see if there's anything I'm interested in that seems like it would be a good fit for what I'm trying to do at this current point in my career. And so that's how I kind of, and then so I've also kind of also adapted that strategy for like other foundations and like internal awards, where I'll just kind of look at the websites every couple of months and try to see if there's anything that maybe fits with what I'm that might be a good fit for a project I'm interested in, that I'm either currently working on and needs more support, or if there's anything that I'm trying to get started up where we could use some support as well.
Yeah, it's pretty similar. My mentor was a good source for that. And it's not just necessarily like your the mentor that you're working on that research project, talking to, anyone that's sort of mentoring you about your interest in research, that if they, if anything comes across their inbox, and, I've had that discussion with them that I'm interested in health disparities research, I'm interested in, neuroscience, whatever the topic you're interested in. I find that, those mentors, even if they're not even related to research, will also forward me those things if it comes through their inbox. And so that has been a source of me finding out about awards, that I wouldn't have directly known about. Also, just kind of looking at those websites like the APA, ACAP, website, they have a lot of information on there, and it's broken down by where you are in your career. So it's good to kind of like also kind of compile a list of some of these awards, because sometimes you might look on the website and you find out, oh, I just missed the deadline, but it comes back around the next year. So you can just kind of build your own list of sort of targets, and then kind of put reminders in your calendar for like when it comes around the next cycle, if you see something. And also just talking to other people who are doing research, and asking about what grants or awards they've applied to in the past. That has been helpful. Like I essentially can sometimes just kind of get someone's resume or something like that, and kind of see like, okay, like they've gotten this award, oh, and ask them like, oh, by the way, like I noticed that you got this award, and reach out to them like, what's your experience with that, like, would you look at my application, can I look at your application? So it's a little bit of networking, using some of the resources on the websites, and just kind of talking about your interests to your mentors.
My strategy has been a little different. I just open your emails from ACAP, and then go through the emails and look, because emails usually come saying like all the opportunities. So as long as you just open those emails and read them carefully and see if there's anything that's in your interest, follow it, and then you'll get to the website. I have not checked like periodically or credit list, but for me, like opening the emails and being very curious about the different things that they offer, it's kind of like that's the way I've gone to like a lot of the opportunities I've had in grants and fellowships and awards. Just open the emails.
And then we got another question. Any tips for finding and connecting with mentors for particular research interests when you don't have strong research at your home institution?
Yeah, I can go first actually. I have kind of an interesting experience with this. I think so. I ended up doing my PhD work in a lab that was only very kind of loosely affiliated with my PhD institution. And they were in the same town, but but it was only affiliated but the entire site was located on a different campus and everything. And so I think how I got kind of hooked up with that was that I was talking to some folks as I was going into my PhD about some of the ideas of what I wanted to do and things with that work. And one of them was, I talked to the person who was probably doing the closest thing at my PhD institution, and he's like, well, like my lab could be a good fit, but I think that there's this other person at this other institution that's local to us that has some research funding and is looking to hire hire graduate students, and he gave me his contact information, and he's like, you should email this person. So I was able to email that person, and and we really kind of, I met with him and talked to him about what I wanted to do in graduate school. And it was really, and that one was, it was like that feeling where you get where it's like, this is this is perfect. And so, I think that one of the things is still talking with people at your institution, because folks, they know other folks in town who are local, who are doing things maybe at other institutions. And then also, not being, not being afraid to kind of go ahead and, and reach out to those folks. In all honesty, most people that I've reached out to are, about research, have been really, really nice people. So, I get a little bit nervous, reaching out to people in general, but, I've never, I don't think I've ever had a bad experience, like someone being like, no, you're at this institution, you're at this institution and I'm at the other institution. Why would you ever contact me? So don't be afraid to to use the network within your own institution, but also to really put yourself out there, particularly if someone from another local institution is recommended by someone.
Yeah, I think I agree with that, kind of putting yourself out there, even though it's like kind of hard. But I think one thing couldn't help with sort of that process of putting yourself out there is to just also remember that, even if you haven't done like research in like the traditional sense, that you have skill sets that can be an asset to, any group or lab that you're interested in. Like if you are, you're very organized, if you are a good writer, if, there's, if you're creative, like, if you're good at art, like, it doesn't really matter, sort of like, you just, whatever skills that you have, like, can be valuable in a research setting. And I think, like, to just remember that. And then also if you express interest, that goes a long way, right? Like if, you're interested in that area, you know, and you're talking to someone about that lab, maybe read a little bit about, the projects they've worked on, their website, maybe like a paper or two, so that you're going in there with like some curiosity and some information. Um, and just expressing that interest, I think that can go a long way. Like if you don't actually have that research experience, and I've found that people have been open to talking about, I mean, I feel like a lot of researchers love talking about their work, so any opportunity to do that, they're welcome to. And just expressing sort of like where you want to go. Like if you don't have that experience, you might kind of talk about more about like what you're hoping to build, and what skills you're hoping to build in that research field. And I think that you'll find that when it's a good fit, like you'll know. And yeah, putting yourself out there is an important part of that. I've sent so many just cold emails to people that I've never interacted with in real life, and it's worked out. It's worked out fine every time.
Just to add to that, two additional things. I agree with everything that's been said, but there is value in kind of engaging with organized psychiatry, AACAP, fellowship committees. And I think when you work on something different that's not research with someone, because there are like affinities in the work that you do, it's easier to kind of like stay in touch with them and then follow up. And then even if in that moment you can't think of anything, that person could kind of help you out in the future with a research idea or looking into some like method. So when opportunities come up, even it's for a opinion piece, or just take advantage of it, because that connection is going to be very potentially useful in the future. And the second thing was that kind of like be very intentional about that there is kind of like similar, because I think at the end it's about like passion, similar people have similar passions that move, like that what moves them are similar to the things that move you. And then collaboration and research and mentorship is going to be not only kind of good for research, but also for personal growth.
Our next question was, for any of you who fast-tracked, when and how did you get involved in child psych research in residency, especially if your CAP clinical research is in PGY2?
I did fast track, and I think that I just became aware of, who was in the department, of child and adolescent psychiatry and what projects they were working on, and reaching out to them early if there were things that I was interested in. But it's not that you have to start, before, but it for me, like, I knew that that's what I wanted to do, and there were opportunities there, but you don't necessarily have to put pressure on yourself to, like, kind of in PGY2 decide to do research. I think that there's always faculty in the CAP department that are accessible, and also, like, if you are working with someone who is more of like in adult psychiatry, like, you could always like collaborate with multiple mentors, like, and create a project that's, you could take a project that might be, going on in the lab already, that's an adult psychiatry, and sort of think about looking at it in children. And that could be a new way of sort of adding uh, um, just a novel approach to something that's being done. So there's ways you can do that, and then you can collaborate with the child psychiatrist to kind of get that expertise in the area that you're looking for.
I did fast tracks. Where I did residency at BMC, we don't have a child psych department at all. So I applied for 2 grants my intern year. So I was a PGY one on adults and one in kids. And it was just based on like things that I thought were important for me. And then I found the right people in the department that had some experience. I think it was someone that worked like a multicultural center. That was a psychologist that didn't work with kids, was the one that gave me the idea of doing it like undocumented children. And it worked out. So it's more about kind of, again, finding something that it's relevant, and don't overthink it. Like, if you see an opportunity, like the worst case scenario, you don't get it, but people get stuck in like overthinking and having the perfect submission. It might not happen, but if it's something that it's interesting, give it a try, and then you can start polishing. If it doesn't happen, and do it again. But kind of like going for it, I think it's what's most important, especially early in training.
Yeah, that also reminded me that yeah, like, to just kind of also look outside of your department, because, like, I do research with, psychology, adult psychiatrists, like, it doesn't have to be like just sort of like in your direct, works with public health, special, like, just anyone that, like, I think don't think of like your department as like a barrier, right? Like, a lot of synergy happens across different fields, especially like when it comes to like DEI research. And sometimes someone like in another department probably might have more time than some of the clinicians might have. So that might be a better fit for mentorship as well. So just kind of think broadly, look at the other research talks that might be coming through, that you might see in your email from different departments. And if there's a topic that comes up of your interest, go to the talk and ask questions, reach out to them. So kind of thinking, broader about who might be doing work that you're interested in is important.
And I want to add something else to that. And it's okay to take the lead, even if you're earlier in training. I recently submitted a grant with like wild like researchers from SB, and they have like NIMH grants, and I was like, I need this from you, can you help me out with this? Like, taking the lead is okay, and like that also helps you get into the habit of like, how do I think about this idea, how do I write it down? So also like go for it, and don't be afraid to take the lead and kind of use the resources, which is our like mentors, people in different departments, different specialties, different settings, right? Especially when thinking about community-based research, for me, it was really important to get in touch with people in the school system, because it's where I wanted to do the project. So yeah, going for it.
Our next question is, what kind of barriers any of you faced doing research with specific demographics that you were working with, for example, immigrants, and how those barriers were overcome?
Yeah, I mean, so I think I was pretty fortunate in graduate school to be, so the organization where I did my PhD was based out of a residential treatment facility for youths with disruptive behavior disorders. And so we had the ability to we had the ability to just kind of walk down to the next building and get our research participants and bring them to the scanner. And and since they were supervised, they were living temporarily in this environment, like we didn't have to necessarily we didn't have to look outside too much outside like the campus itself. I mean, it brought people in from like all over the country, so it was certainly a more diverse population than you would find in most places in Nebraska. And so that was something that was something that I was kind of pretty fortunate to kind of fall into and be a part of. And now that I am working in a university-based setting, I know that folks I'm collaborating with, we're working with other people in and around the department who already have a lot of relationships with the community around us, to make sure that we are continuing to recruit a population of individuals that reflects kind of the diversity of folks who have who have substance use and psychiatric disorders. So I think kind of leveraging relationships that folks in your department already have, asking around about who, particularly with the folks who work with those populations.
Yeah, I mean, I definitely think that if you're trying to work with a certain population, that you try to find people who've worked with that population before, like, and have like existing connections, like community partnerships, like community centers, like is sort of like a good target, like any place that you've like worked in, like if you're still if you're like in training. I've found that one clinic that I had rotated through as a PGY2, I ended up reaching out to their leadership, and because it was a community center, and being able to sort of start up a project in that particular center with the leadership there. So just kind of looking into the community, like connecting to people that have worked in the community before. And in terms of just like other data out there, like, read papers like that are about this population, and see, like, get ideas about what communities people are looking at, and sometimes they will have some of those strategies and information in the literature, and you can sort of model that in what you're doing when you're developing your own project. There's actually, there's a lot of, cool work out there, but I think probably doesn't get communicated, like, and presented, like, as much as it should. So there's a lot of good people doing work in different communities. You just kind of have to kind of search for it.
In my own experience, because I did research with undocumented children, it's also the process of getting very creative and having the right mentors. Like, okay, because you go into it with a cultural safety lens. The priority in my case was to make them feel as safe as possible. So how do you get consent? Do you need consent, assent? Are we gonna get signatures? Are we connect identifiable information? So there are a lot of things that start coming up, but as you do the project, you can start having a better idea of how to approach the same issues in the future. So I had a great mentor that had a lot of experience. So she was like 3 steps ahead of every step, and it really helped me kind of like think about those things in a critical way. So I think it's a great like learning experience. And like my co-panelist mentioned, the co-creation of research, I think it's beautiful. And I think it's where a lot of the community-based research is going, kind of getting input from the community that the participants are coming from, and sharing the results with the community or the participants that you use for the research. Because sometimes we forget that it's not only extracting information, right? It has to have a purpose, and you need to give that purpose back to the community that your participants came from.
There's actually something else that I thought of, which is that like if, for whatever reason, like there isn't necessarily a person in your department or around you who's working with the population that you're interested in working with. So I mean, all NIH research is taxpayer funded, right? So that leads to kind of two things that the NIH is really trying to make sure that researchers do, which is first, like making sure that the publications are like freely available to American taxpayers. But the second is that they are wanting researchers to share their data more. And so the National Institute of Mental Health kind of runs this website called the NIMH Data Archive that you will have to, that has data sets from lots of research, research groups from around the country where they've uploaded things. So if you maybe don't have like someone who's working with the specific population, maybe trying to get on there and see if there are any projects that that either have like a really big sample size that that you can look at and see if maybe you can identify some folks within that population of interest to to maybe analyze some data from, or looking and seeing if there are any groups there that have uploaded data pertaining to your population of interest, and that data is freely available. There is some registration that is involved, and it may involve like kind of your university's kind of research office to to kind of help you get get your account on there, but it is something to be aware of because it is free.
Our next question is, how do you divide the time you spend between your clinical duties versus research projects in residency or fellowship? Is structured time allotted by the program, or is it time that you have to carve out on your own?
I was muted. For me, I do have research time allotted by my program, which is really helpful. And I think that one thing for me is that I do, as much as I try to keep research time research and clinical time clinical, that there are things that happen there, particularly with clinical work, there are patients who call in crisis or something. So so trying to make when I scheduling myself, trying to make sure that I am kind of factoring in kind of a fudge factor on my time, to make sure that like I have some, I guess, swing time to, if I do need to return a patient phone call urgently or something like that. So, and my particular program has been really great about protecting time for research, because my residency program, like the services are not resident dependent, resident or fellow dependent. So so that has been really helpful in making sure that like that when I do, when they tell me I do have that time, that I don't run into any issues with attendings who want me to stay for whatever reason.
I've had different sort of setups in terms of like residency and being able to do research. In the beginning of my adult psychiatry training, I was in a research track, and so that comes with some protected time for research. It was like 1 or 2 months where you were responsible for call, but you had protected time to do research during that time. and that was like available to everyone who was interested in research. So it was not necessarily like, oh, it's like a track I have to apply to it. If I wasn't in it, then I couldn't do it. And then I've had like sort of like third year, like half a day a week, or or a full day of dedicated research time, which is very difficult. As you can imagine, like a lot of times your therapy cases, your your outpatient clinic cases can, just the tasks that come up like kind of can bleed into it. But I've tried to block out like periods of time where I'm saying like, okay, this is where I'm gonna focus on research. Like, this is, if it's a half a day, then I'm like, okay, planning out for that half a day what I'm going to be doing, and trying to plan that out like I would anything else in my schedule. And then like now I don't really have like separate clinical time, but like I can take research electives. So if you have like elective options like in residency, like there's usually an option to make like a half a day or something like that, like a research elective, and that gives you like extra time during the week. But sometimes it's kind of, it can be very piecemeal. It's not the best way to do research, but depending on the type of research you do, it can be very feasible. So it definitely varies depending on, where you are in your training. But I found that a lot of programs do value like people interested in research and will give you at least like some elective time to do it. And then you can find little pockets within your schedule where you can block out time and focus on it.
It is challenging at times. During residency, I did not have time for research, and during fellowship, I still don't have time for research. But I've had great mentors that who I've learned a lot, not only about research, but also how to like organize my time, the importance of a calendar and putting things on the calendar, and like small things that really help me kind of organize and be able to do different things simultaneously, like in organized psychiatry, research, and kind of like more in clinical spaces. And I do think that psychiatry has the advantage that there is some downtime at work. So I kind of like try to maximize the things that I do when I'm at work, because I feel like I do a lot of things, but my weekends I try to protect as much as I can. So it's very important to also protect the time you have for yourself. That way you can do more things, right? Because like you spend too much time doing the same things and starts leading to burnout. And early on, like my second year, I started feeling it. So it was like I really learned that really need to protect the time to take care of myself, so I can continue doing the different things that kind of like I was passionate about, and not kind of like have it become burdensome.
Yeah, I echo that self-care is important, especially when you're sort of juggling like clinical and research. And like I've gotten to the habit, like I've learned from like my experience of research that really, like, if you're passionate about something, like you can work hours and hours on it. Like but you shouldn't always do that. And so just remember that, like, it will get done, and you can plan it out, you can break it up, you can put deadlines, break up the project that you're doing into small little tasks. That really helps you sort of manage the time a lot better. And then also remembering to schedule your breaks, because it can be really easy to fill your calendar with like, okay, I'm doing this and doing this, but think about scheduling your breaks like you would like when you're studying for an exam. Schedule your breaks, schedule your day off. Like that should be in your calendar, and that should be prioritized just as much as the research and the clinical.
I agree. I get myself, it's still a learning experience for me. I get myself into trouble where I am, where I'm working on a certain thing, and like and I just lose track of time, and oh, there went the Saturday. I and I totally only meant to spend an hour on it. So I definitely so that's something I've been working on in the last
And Do you have advice for someone who is new to research and is feeling overwhelmed by how much there is to learn?
My advice is that a surprising amount of research is is just kind of like or at least my research is me kind of being like, looking at some data and being like, I wonder if this is gonna work. I bet it won't, but but it would be cool if it did. And then kind of running the analyses and it worked or something, much to my chagrin. And I kind of think in talking with folks that there is a certain element of like, just like people like, they publish their papers and I talk to them about it and they're like, yeah, that was, that came from an idea that I had when I was like at a happy hour with, such and such friend or something like that. And so all this is to say that like I think, that just have like just kind of running with some of the ideas that you have, like you're the only one that has your unique perspective on things. And so I think that and I think as trainees, like we all, and even folks in faculty positions can use a little guidance on kind of maybe how best to package the ideas and like and stuff like that. But like you're the only one with your unique experience and kind of spin on things. So like so I think that remembering that many of the ideas that you bring to the table are pretty original, and even if you're not like even if you haven't necessarily reviewed the entire literature, sometimes having these new ideas to bring to the table really can move a field forward by like asking questions from just a slightly different angle or something like that.
Yeah, I also think it's also important to remember that like research is about kind of like not knowing everything. It's like sort of it could seem like, oh, like we're generating all of this knowledge and like we need to like learn all of this knowledge, but it's like actually more of like just kind of saying like I don't know, like and it's okay and I'm gonna figure it out, and that's okay too. And I always had a mentor that was said that like the most important thing to remember about research is like you have to just kind of get a little comfortable with like failure and just like not understanding things. Like that's part of the process, and not getting discouraged by failure or not knowing things, because that's actually the most common part of research is like to try something and for it to fail, and then you try something else and it might fail, and then something might succeed. And that's just as important as the three failures you had before, because the three failures you had before led you to trying this new thing that did work. So just remembering that, and then also kind of making like little mini goals for yourself, like because I think like sometimes it's overwhelming because we're trying to do too much, and like maybe like what we're aiming for might not be sort of like as realistic like as it can be, and sort of working with your mentor to sort of like try to find like little goals for sort of like what you're trying to do accomplish in a project. So it might be a mini goal, might be like, well, I want to do one presentation this year on a topic like that I'm interested in, and that's what you're going to be working towards. And that can just help you sort of build the skills like in sort of collecting the information for the presentation, coming up with ideas, like solidifying the ideas, and then working on presenting the ideas, and just kind of narrowing it down a little bit, and coming up with mini goals, I think can help sort of not feeling as overwhelmed.
Just to add to that, learning isn't like a continuous process. Like there is no goal. In qualitative research, the only way you learn it's by doing qualitative research and kind of getting to the process of how do I think about things, how do I think about different like things differently. So you learn doing it. It's a continuous process, and you already know what you need, which is what the idea that you're creating. So I do think that just being very curious. I think curiosity is the main thing that will help you succeed and excel at research. Being very curious about every step. That way you enjoy it, because I think that it can be enjoyable. And I think the most important thing, ask for help for whatever. There are so many things involved in research. Some people might help with the planning of the methodology. Someone who knows about like statistics. Someone might help you think about creatively about the ideas. Someone might help you look at infographic and comment on it, because Melissa helped me during my last grant, like looking at the infographic, make sure it's done. So ask for help, ask for the people around you, your peers. Everyone has amazing ideas. So I think it also can be a collective effort, and it's very enriching when you have different perspectives. So asking for help, I think it's the most important part.
I think one thing that that certainly got that I wanted to highlight that I think Dr. Brown said is like in research, like you're gonna like, I will say, like, even though like so much of my ideas are like, I wonder if this is gonna work, probably 8 times out of 10 they don't work. And like it's and I'm not necessarily just kind of randomly doing stuff. I'm like, having done the my area of work for a while now, like I do have like a pretty extensive like experience with the type of data that I'm working with, to kind of work through like, okay, why is this not, why does this not working? Is there something I can try to like to kind of tease out these relationships? But I think one thing, and I saw this a while ago on like social media, is that there are some folks that like some really successful researchers who posted like these things called like failure CVs, where like they, instead of listing the grants they got and the publications they got, they listed everywhere like that, like all the grants that were rejected and all the all the journals that they had been rejected from. So so that leads me to kind of the my next point, that like that rejection in research is probably more the norm, but like it is but it is like but don't get discouraged by it, because even the most successful researchers have gotten rejected from things more than they've gotten things accepted.
No, and just reflecting on my own experience, I think reframing it might be, because it sounds a little disheartening, like be ready for failure and rejection. I like the times that I face difficulties, I come out like afterwards having learned something that I didn't know before, something that kind of like changes the way I see things when I do move things forward. So more than failures, they're like very key learning experiences that you'll never forget. And that's how you become an experienced researcher, right? Trying things and trying different things.
Yeah, I mean, I echo that, and I think like the only way to essentially like get grants is to just remember that you have to apply. Like, so you have to take that step. Like, and if you don't apply, you're definitely not going to get the grant. So it's about kind of being persistent and learning from your mistakes and trying different angles. And I could be transparent and say like I probably like in the last 2 years applied for like 6 grants and I got 2. So like, and each one rejection just made the next one like, okay, like they were interested in, they didn't really understand that point that I like wrote about, and so then I could sort of correct that in the next try. And so just keep trying basically. Put yourself out there. I think it's just it's part of the process, and it will be fruitful.
Thank you all so much for spending time with us tonight. It was really wonderful to hear from all of you. Thank you so much, Dr. Aloi, Dr. Brown, Dr. Velez. really valuable information, and I know that we all really appreciate it. I'm going to put in the chat a survey for that if anyone can fill it out just to provide feedback, that would be wonderful. So we can have an idea of what other things people would like to learn about and hear from. Otherwise, our next workshop will be on January 18th, and we'll hear from Dr. Jerome Taylor. Yeah, thank you so
Thank you.
much.